So what do our patients need to know about the microbiome? It's 2021 and we've barely scratched the surface.
Well, microbiome is kind of a relatively newer concept in medicine in the sense that we know that it affects our immunity. It also plays a major role in metabolism and energy processing. These are, for many years we knew that our gut is populated by bacteria. We didn't know how many. We have 10 trillion bacteria in our gut, and it's not just bacteria. We have fungi, viruses. There is this humongous united nation that is sitting in us. We're actually hybrid organisms. And all these bacteria are working. The diversity, like you said, is extremely important.
Very important in case of somebody who has to take an antibiotic for any reason.
Right, and it's not just the antibiotics. Microbiome is impacted by many other factors, like the way the baby is born. If the natural birth of the baby is the beginning of the exposure to microbiome, the nursing also improves the microbiome. With age, microbiome changes geographically, depending on where the person lives, also impacts the microbiome. The level of exercise affects the microbiome, and psychological factors can impact. But one of the, like you mentioned, the medications, particularly antibiotics, can kill multiple bacteria simultaneously, and since their goal is to kill bad bacteria, but they also kill good bacteria.
So we often will recommend to our patients to replenish the bacteria in various ways. There's probiotic capsules or tablets or drinks, but there are also a lot of healthy microbes that are in our foods.
Right. So it can be, well, first of all, we call them prebiotics when we get them and our bacteria uses them. They're prebiotics, like most of them are in form of fiber, but they also can be in fermented foods like fermented vegetables, and yogurt is full of bacteria.
Prebiotics are the fiber and other factors that give a place for the bacteria to live, and then there are the probiotics, which are the bacteria themselves.
And the fermented foods and yogurt, those would be probiotics, versus fibrous foods would be prebiotics.
So some examples of fermented foods would be
kimchi, would be pickles, would be sauerkraut, kombucha, certainly yogurt.
Cheeses. Kefir.
Yeah, the importance of the very interesting fact about microbiome is that we notice that the energy processing is done by our bacteria. Years of eating sugar creates type of a bacteria that is very energy efficient. And frequently you hear people are saying, oh, I'm eating very little, but I am gaining weight because the bacteria is very, very efficient. That is how...
and there have been some studies that have looked at transplanting bacteria into another animal or human subject to change the way that they process energy.
Yeah, if you transplant bacteria from a thin person to an overweight person, you might actually populate their gut with a good bacteria.
And vice versa.
Microbiome also impacts the mental health, and there are many studies about importance of microbiome for ADHD, for depression, for anxiety. So all of these are very important. Stress negatively impacts the microbiome. One of the problems we have today is that we do not really have medication or the right bacteria for the right person. So I think
our understanding of that is still very rudimentary.
Correct. Well, we know that meat eaters have bacteria that is also negatively impacting the colon permeability and also can be causing colon cancer. So that's studies have shown. But like you said, many other things like how to get the good bacteria is not well known. But be friendly to your bacteria, eat fiber, eat fermented foods, drink lots of water, your bacteria will be grateful to you.